Well, since its inception 75 years ago, the Veterans Health Administration has been evolving to meet the unique health care needs of veterans from every era. To date, Veterans Health Administration has provided health care to more than 6 million veterans. John Jenson, Chief of Staff with Veterans Health Administration, an Army veteran of the Gulf War and Operation Iraqi Freedom, joins us this morning to talk more about all this, meeting these health care challenges for veterans and how it's working to provide well-rounded treatment for veterans. Sir, thank you so much for your time. We appreciate it.
Yeah, thank you so much for having me.
In the work you do, just to talk about the push to make veterans aware of the benefits and opportunities they have with the VA and the VHA, I think so many veterans do know, but I guess the message still hasn't gotten out quite to everybody like it should have.
Yeah, we want veterans to know that the Veterans Health Administration is the healthcare system designed specifically for veterans. We understand veterans. We know the issues, illness, and injuries caused during their time in service. We specialize in providing care for those type of things. And it's important for veterans to know that in many cases, it's veterans caring for veterans. Almost 1/3 of our 380,000 dedicated employees in VHA are veterans themselves. And so in many cases, it's veterans caring for veterans. That's just really important, I think, to all of our veterans to know that. I would also note that VHA is also really found to be one of the best healthcare systems in the country, and I think that's also important for veterans to know.
Yeah, absolutely, and the care that the veterans deserve, and also with innovations and specific care, maybe in some cases catered to veterans. Talk a little bit about that.
Yes, so we've really been on the forefront of innovation and research since our inception in 1946, where we partnered with academic affiliates and continue that partnership today. 97% of all medical schools in this country actually partner with the VA, and that means we're understanding, knowing, and providing some of the best healthcare, newest additions to healthcare, newest research done in healthcare. We've been on the forefront of so many things, such as the first liver transplant, the first implantable pacemaker. We helped develop the CAT scan, and today, through 3D printing, we're actually able to provide and fit prostheses for our veterans. And so we remain on the forefront of this, and that helps with our research, as well as we're one of the largest research organizations in the world, and that means that veterans get the best and brightest from us.
That's wonderful. And to be on the cutting edge, like you said, of treatments and medicines and everything. I know it's such a big undertaking for the VA to make sure they're treating veterans and meeting them where they are, from major cities where maybe it'd be a little easier to have a big presence and a great facility, to also rural communities or inner city communities, wherever veterans might be in the United States. I know you want to be there.
Yes, we want to be where veterans are, and that's really what our focus on. Since the pandemic, we've increased telehealth to 1,500% from what it was previously. Almost 180,000 appointments last week were conducted through the telehealth modalities, and that's really important. That means we're outreaching to veterans where they are. But we outreach to no matter who a veteran is, to ensure that they understand they can get safe, quality care with us, that we welcome every veteran. Veterans of color understand that the VA is there for them, and we treat them that way. Early on, as we developed the vaccine, we outreach to communities of color for them to understand and for us to answer questions on the importance of the vaccine, et cetera. Today, African American and Hispanic veterans actually have received the vaccine at higher rates than our Caucasian veterans, and I think that's really done through outreach. And I would just mention women veterans as well. Women veterans are our fastest growing cohort of veterans. Almost 1/3 of what it was in 2001 to 550,000. And we specialize in providing women veteran care, and we will continue to do so.
Wonderful. What is the best way for a veteran to get plugged in, not only maybe if they haven't been involved with the VA, but also maybe if they had once or twice, but to get kind of up to date and get back plugged in? What would you recommend? Best way to get in touch?
I think the best way is reach it to your local facility. If you're not signed up for care in the VA, you can go to va.gov. We'd be glad to help you sign up. Hey, we want to be the best healthcare system and the system of choice for our veterans, and we're committed to doing that every single day.
Wonderful. John M. Jenson, Veterans Health Administration Chief of Staff. Sir, thank you so much for your time, and thank you for your service. We appreciate it.
Thank you so much, and happy Veterans Day.
Thank you. You too.